inquiry called a horrific tragedy, here to see if they'd get an explanation. Nearly 2,000 haemophiliacs have already died after being infected with HIV and hepatitis C. Thousands more, like Hayden Lewis, are living with the conditions. Many were treated using blood from American prisoners and other donors at high risk of carrying infection. This wasn't a public inquiry. The government's always refused to hold one, though the Scottish government's promising one. Lord Archer volunteered to conduct this investigation and concluded there have been many failings. He criticised delays of several years in stopping blood supplies from abroad. Patients weren't properly informed, not always told they'd been infected, and the problems with American blood supplies resulted from putting money before safety.
It was a horrific human tragedy. First, because of the numbers involved. Secondly, because of the consequences for those who suffered. And thirdly, because of the feeling that a lot of people are left with, that it might have been avoided.
There's now careful screening of donated blood, but Lord Archer called for more thorough checks and proper financial support for victims. But the question is whether the recommendations of the inquiry will actually be carried out. The Department of Health has said it'll study the report findings in detail. But in the past, it's always said that the government at the time acted in good faith, according to the information that was available. But that's not good enough for patients like Hayden Lewis.
I want to wake up one morning and not have to think about this issue, because that's how you live a constructive life. This is I had a ball and chain around my ankle for 20 odd years, really, trying to get it addressed once and for all with some closure.
And though treatment has been changed, many people feel closure's still hard to find. Jane Hughes, BBC News.